my name's Gabrielle Jackson. I'm an Associate News Editor at Guardian Australia, and I'm also the author of Pain Prejudice, A Call to Arms for Women and Their Bodies, a book that came out in Australia, New Zealand, and the UK and Ireland in 2019, and which is coming out in the USA and Canada next March. I wrote the book because I have endometriosis, adenomyosis. I've been diagnosed with chronic fatigue syndrome, irritable bowel syndrome, and I have seen physiotherapists for over 20 years for back, hip and leg pain, which I thought was down to a skiing accident I had when I was 19, which explains perhaps why the physiotherapists couldn't help me. In 2015, I went to a conference that was put on by an Australian patient advocacy group called EndoActive. Really unhappy with the lack of information there was for women who have been diagnosed with endometriosis, a young woman and her mother decided they'd fix it themselves. They got together Australia's leading doctors who had specialised in endometriosis, researchers, nurses, physiotherapists, and they put on a conference for patients. I went along to cover it for The Guardian. I thought, well, I'm not going to learn anything, but I really applaud the effort. Little did I know how much I didn't know about the disease that I'd known I'd had since my early 20s. I thought I knew everything there was to know about endometriosis, and I didn't. That day, I heard that women with endometriosis are almost 200 times more likely to be diagnosed with chronic fatigue syndrome. I'd become embarrassed to tell people I'd been diagnosed with chronic fatigue syndrome because I'd been trained to believe that it wasn't really a thing. It was just something hypochondriacs said. In fact, I started to label myself a hypochondriac so it wouldn't become an insult whispered behind my back. I could see that I was different to my friends, why I suffered from headaches and nausea and dizziness and incredible bouts of fatigue that I couldn't overcome. Period pain that floored me. I literally couldn't move. I would be walking along fine and then I would not be able to walk anymore. The pain was so intense. I would be vomiting regularly. I would have diarrhea. I had such intense nausea I couldn't move, almost bringing on a vertigo. I also suffered from incredible cold sores. I seemed to have all these things that made me a hypochondriac. No one had as many things wrong with them as I did. And then at this conference, I realised that actually all these complaints, the dizziness, the headaches, the fatigue, the irritable bowel, the pain, the back pain, the leg pain, the hip pain, they are all actually really common symptoms of endometriosis. And more than that, common symptoms of chronic pain. And this is the thing that I discovered when I started writing my book. This isn't a random collection of symptoms that makes doctors roll their eyes and say, oh, everything's wrong with her. We just fixed the period pain. Now there's the headaches and the dizziness and the nausea and the irritable bowel, and some people have bladder problems and migraines. They are all very common symptoms of chronic pain, something that happens when the central nervous system becomes sensitized to pain. It used to be called central sensitization. It's now called, the International Association for the Study of Pain wants us to call it nociplastic pain. Now, there are lots of reasons this hasn't been studied by medicine. There are lots of reasons that medical science doesn't understand chronic pain. I think the main one, it's fair to say, is that most chronic pain patients are women. About 70%, in fact, of chronic pain patients are women. And there's a problem that 80% of drugs used to treat chronic pain have been tested on men or male rodents. We know that women generally experience more recurrent, more severe and longer lasting pain than men. Fibromyalgia, irritable bowel syndrome, rheumatoid arthritis, osteoarthritis, temporomandibular joint disorder, chronic pelvic pain and migraine headache are all more prevalent in women than men. In headaches, neck, shoulder, knee and back pain, the ratio of women affected to men is 1.5 to 1. A Dutch study on pain in children showed that the difference in experience of pain between the sexes started from a young age. In the first 3 years, it was roughly the same, but by the time girls hit puberty, it really just went off the charts. Between the ages of 8 and 11, more than double the number of girls and boys experience pain, and the ratio continues to increase from 12 to 18 years of age. Researchers found that girls were more likely to experience multiple pains and more severe chronic pains than boys. So this starts from a very early age and it goes until menopause, basically, and it starts to even out after that. There are 10 chronic pain conditions in particular that cluster together in women, and they are endometriosis, which is often associated with painful periods, vulvodynia, temporomandibular disorders, chronic fatigue syndrome, irritable bowel syndrome, painful bladder syndrome, sometimes called interstitial cystitis, fibromyalgia, chronic tension type headache, migraine headache, and chronic low back pain. There's also often pelvic dysfunction and pelvic muscle spasms. The US Congress and the National Institutes of Health have described these as chronic overlapping pain conditions in order to recognise their relationship to each other. Once one woman gets one of these conditions, they tend to accumulate. Not everyone who has one will have all, but as I said, once you experience one of these conditions, they tend to accumulate, and that's probably because of what I said before, this sensitization of the nervous system that starts to happening, that sensitizes all the other organs, which would explain the bladder and the bowel problems as well. There is very little known about these conditions, and as I said before, almost everything we know about human health comes from the study of male men and male rodents, even male cell lines. Now, in 2016, the National Institutes of Health made it mandatory for studies that they funded to include both male and female rodents. But a study released this year that was a 10-year follow-up to a 2009 study by Irving Zucker that ended up being seminal, looking at the inclusion of female animals in the biological sciences, found that since the 2016 ruling, yes, more female animals are included in biological science studies, but they are not being analysed for results. So they're including the females as a tick box exercise. They're not actually analysing if there were any differences in the male and female animals. We simply don't know how much of a difference there is in male and female biology right now. This is a huge problem, and it's a huge problem for diseases that mostly affect women. Now, the men who suffer from these chronic pain conditions obviously suffer as well, because the same lack of knowledge exists. In fact, I've heard terrible stories of men with fibromyalgia basically having their very masculinity questioned, because it's a disease that women get, it's a disease that basically hysterical women get. It's not only that there's a lack of knowledge about these conditions that predominantly affect women, it's the same with autoimmune conditions. There's been some improvements in things like rheumatoid arthritis and lupus in recent years. As you all would know, about 75% of people with autoimmune conditions are women. And that's, we know that the female and male immune systems are slightly different. And that's why more women tend to get autoimmune conditions. I think this is even more important in the time of COVID. Unfortunately, more men die, and that's not uncommon. We know that more men die of infectious diseases, and that's because the female immune system tends to mount a more robust response, and so women can survive things that men can't. If we knew more about why the female and how the female immune system was actually different to the male, we might be able to save more men from infectious diseases such as COVID-19. So it's not just about helping women. Understanding female biology is important for all human health. But importantly, there are a lot of women out there who are suffering. There's 176 million with endometriosis alone in the world today, not to mention all the other conditions that I just mentioned. There's a big risk that COVID-19 triggers things like fibromyalgia and chronic fatigue syndrome. We know that chronic fatigue syndrome is often triggered by a viral infection or a toxic exposure of some kind. And people with long COVID are already experiencing very similar symptoms to chronic fatigue syndrome and some of the other chronic pain conditions that I mentioned. So there is a really urgent need to study these things now, and we have a great opportunity. We know the trigger, we know the initial COVID-19 is the infection, and we can follow patients to see how they develop other chronic pain conditions and perhaps understand a little bit more about how we can stop that developing into conditions like fibromyalgia, chronic fatigue syndrome and the others. Endometriosis has become much more talked about and popular. There's a lot more understanding, which is a great thing. But it's important to say that one of the reasons endometriosis is becoming more recognised, is a little bit more respected among the chronic pain conditions in women, because there is a physical aspect. Doctors can cut up and see the endometriosis lesions and cut them out and feel happy. The problem is, we know that the severity of the physical disease in the pelvis or in other parts of the body where it exists does not correlate to the severity of symptoms in the patient. And more research is showing that's because the symptoms of poor sleep, anxiety, dizziness, nausea, headaches are not caused by the endometriosis lesions, but by the central sensitization of the nervous system, this thing that I keep talking about, nociplastic pain. So that's where I want to see science go from here, understand more about that. So there is a lot of work to be done to overcome all the problems that we have in a misunderstanding and a lack of understanding about women's health. I think one of the most pressing issues, though, that can be fixed right now is the one that I didn't expect to discover. One of the things that I didn't expect to find was that not only was there a lack of knowledge, there was a lack of respect. There was a severe lack of respect within medicine for these conditions. Doctors who look after patients with these chronic pain conditions are among the lowest paid, and that exists across I looked at the Australian medical system, our Medicare system. I looked at the US, Canada and the UK, and the same underpayment exists across all those. Gynecologists are among the most lowly paid specialists. GPs who spend longer with their patients, which is required for chronic pain patients, get paid the least. Women tend to self-select female doctors, so those doctors end up spending longer with their patients and earning less. Even when it comes to the insertion of a Mirena. In Australia, a gynecologist can do it or a GP can do it with a special qualification. They're paid about $70 for that. And that also requires a nurse to be present. Now, the suture of a skin lesion is about $200. And that same disparity in paying for things that considered women's health exists, as I said, in Australia, the UK, Ireland, America, USA and Canada. And why is that? Why do we think that a procedure done on a woman is valued so much less than a procedure that can be done on both men and women, or on only men? Studies in the US have shown that urologists get paid more for simpler surgeries than gynecologists. And even in general surgery, the people who tend to gravitate towards breast surgery are women. They're encouraged to take that path, and even very complex breast surgeries are underpaid compared to much simpler general surgeries. So this is a top-down problem. We don't understand the diseases, so we write off the people who have them. We tend to think they're hypochondriacs and difficult. They're the heart sink patients that no one wants to see, that take a lot of a doctor's time and are not rewarded financially. And the people who do decide to do them have a financial disincentive to actually do it. There are a lot of doctors doing this out of the goodness of their heart. We have to stop. We have to listen to women, believe them, and study them. These are the 3 things that I would like to see change. Thank you very much for listening to me today. I wish I could be there, and I hope it all goes well. Thank you very much.